Again, I'm making a informational video about visiting us here in Bethesda and just trying to highlight a few things that may trip some people up when they come out, either for the first time or follow-up visits. So the first one is, please make sure all of your contact information is up to date. All of this is in the medical record, so phone numbers, emails, primary care doctor phone numbers, addresses, all of that needs to be up to date. And please contact our medical records office directly to do that. Their phone number is 888-790-2133. So 888-790-2133. Make sure all of your information is up to date. That's how we make sure we can get in touch with you when we need to. When you're here, complete all of your travel reimbursement forms and provide receipts prior to departing for home. So if you do all that while you're here, it makes the process way easier for you. Schedules or itineraries for your visit and flight authorizations are generally sent out 3 to 4 weeks prior to your visit. I know this may seem relatively short notice, and we're trying to make that information come out about 6 weeks maybe prior to your visit. We're working on improving that timeline. But in the meantime, just be aware that 3 to 4 weeks before your visit is when we send out those itineraries and flight authorizations. And lastly, regarding travel, caregivers for patients are not going to be covered or reimbursed unless you, the patient, are having a procedure like an endoscopy where you get general anesthesia where a provider is necessary to be with you because you're recovering from anesthesia. If you're coming out for a regular old visit, no anesthesia, no procedures, then caregivers are not going to get authorized in terms of travel and reimbursement or coverage or whatever, and that's a policy that is not within my jurisdiction. So again, just to kind of summarize, make sure your contact information is always up to date. Medical records is 888-790-2133. Complete all your travel reimbursement forms prior to leaving the building. Caregivers are not covered if you're just coming in for a regular old visit. And schedules or itineraries usually will be sent out 3 to 4 weeks in advance. We're going to try to make that better and come out maybe 6 weeks in advance. And my team is working on that right now. So just some quick reminders and helpful tips. Thanks.